Madison Liberty Institute, and I am a Research and Policy Associate. Today we're here with Blaine Conzatti from the Family Policy Alliance, and he's going to tell us a little bit about the organization he works for.
Yeah, so I work for Family Policy Alliance of Idaho. We are a public policy partner of Focus on the Family. We seek an Idaho where God is honored, religious freedom flourishes, families thrive, and life is cherished. So we come down to the Capitol during legislative session and we lobby for parental rights, for religious liberty, for the sanctity of human life, and for other legislation that helps families to flourish and that glorifies God.
Awesome. Yeah, thank you so much for everything you guys do.
It's a privilege.
I appreciate it. Yeah. So can you tell us a little bit about your priorities for this session?
Sure. So Family Policy Alliance of Idaho's top priority this legislative session is a bill called Simon's Law. It's named after a baby boy born about 10 years back in Missouri. He was born with trisomy 18, which is a developmental disability that is the result of having excess chromosomes. Like most children born with trisomy 18, Simon was born with heart defects. And because of that, he had to stay in the hospital ever since he was born. But very quickly, his parents began to realize that Simon was not receiving the same level of care that other children without disabilities received in the hospital. Unfortunately, Simon passed away after 3 months, and it was only after he passed away that his parents learned that the doctor had placed a do not resuscitate order in his file without consulting with the parents, and this probably expedited Simon's death. And so what Simon's Law would do is it would require parents to be involved in the medical decision-making process. When a medical provider decides to place a DNR in a child's file or decides to withhold life-sustaining care or treatment or nutrition or hydration, the parents must be notified and the parents must have the opportunity to take their children to another facility. So this protects parental rights, which is so essential in these sorts of cases.
Absolutely.
You know, parents who are facing illnesses with their children, they need to be worried about their child. They shouldn't be fighting with the doctors, trying to convince the doctors to treat their children. So it's a parental rights issue. It's also a pro-life issue. It helps protect the sanctity of human life. And, you know, unfortunately, there are so many good doctors and hospitals, especially here in Idaho. But the medical community seems to be going in a direction where they determine whether or not a quality of life is a standard of life worth living. That's words that you will sometimes now begin to hear from the medical ethics establishment. So Simon's Law would just ensure that the parents have the decision-making authority over their children when it comes to their children's medical care.
And that's a piece of legislation you're pushing to get past this session.
Yes,
Correct?
that will,
Okay.
Lord willing, hopefully be past this session.
Yeah, for sure. That's a heartbreaking story for Simon and his parents. So.
It is, yeah. They've made it their life mission to make sure that every state has laws protecting the rights of parents in these sorts of cases.
Yeah, that's great. Well, we'll definitely be supporting you on that.
Thank you.
Yeah. Do you have other priorities that you want to talk about?
Sure. So we are working with Representative Barbara Ehart on her Fairness in Sports Act. This would help protect girls and women's sports here in Idaho.
Awesome.
Unfortunately, you know, biological men are beginning to enter into girls' sports competitions, even at the high school level. And biological females cannot compete with biological men on the sports field. And so this would ensure that girls' sports are for girls, which would help keep scholarship opportunities open for girls and allow girls to reach their highest potential in the sports that they're playing.
Awesome. Yeah, that sounds like a great piece of legislation too.
Yeah.
What about threats? Do you see specific threats on the horizon for this session that people should be aware of?
Sure. So one bill that we've already testified against is Senate Bill 1275, which would require 6 months of birth control and contraception coverage in insurance plans.
Oh, okay.
Birth control and contraception, under the definition that they are using, includes abortifacients, which are drugs, as you know, that end a pregnancy after it's begun, after the conception of the child. And so we are strongly opposed to that. That also has religious liberty implications too, because many of these health plans are provided by employers who believe that these sorts of contraceptive devices are immoral and they have religious objections to them. And this bill could require those employers to provide plans to their employees that include these very controversial abortifacients.
Yeah, that sounds concerning for sure. And I think in addition to the religious liberty aspect, even like from a freedom of conscience, broad appreciate you guys taking a stance on that and defending the pro-life community.
Great, thank you.
Are there any other comments that you'd like to add to this video? Things that you would want to share with our audience, or just last thoughts?
No, besides look us up on familypolicyalliance.com, familypolicyalliance.com. We have tons of resources available. We cater to the social policies, and we're so thankful for the work that Madison Liberty Institute does on the wide array of issues that you guys cover.
Well, thank you. Yeah, we're glad to have you today. So thanks for being willing to
I appreciate it, Lindsay.
Yeah, no problem.